Have you ever wondered if your body might be giving you silent warnings, signals that something deeper may be wrong, even before pain or diagnosis strike? Today, we're uncovering something that every man, and everyone who loves a man, urgently needs to know. Prostate cancer is one of the most common cancers among men. And here's the truth that most people don't realize. The body often whispers before it screams. Subtle symptoms may appear long before conventional tests catch the problem, and recognizing them early can literally save your life. In this video, we're going to walk you through 7 medically recognized early warning signs of prostate cancer, indicators rooted in clinical research that you should never ignore. Whether you're watching this for yourself, your father, your partner, or your friend, this knowledge could change everything. So stay with me until the very end, because the final signs are often the most overlooked and yet the most serious. This isn't just a health video. This is your opportunity to take control of your future. Now, whether you're watching this for yourself, your partner, a family member, or a friend, I want to stress this crucial truth. Early detection saves lives. Far too many men ignore subtle signs until the disease has grown far more difficult to treat. But when diagnosed early, the survival rate for localized prostate cancer is nearly 100%, according to data from the American Cancer Society. So let us use these minutes not just to consume information, but to take charge of our health with clarity and purpose. Now let's begin, from number 7 through to the most concerning sign at number 1. Each one is explained not only in everyday terms, but also backed by clinical understanding to help you make sense of what your body might be telling you. If needed, take notes. You deserve not only to be informed, but also prepared. So, starting with the sign number 7, frequent urinary tract infections or difficulty urinating. To begin, if you're experiencing frequent urinary tract infections, UTIs, or persistent difficulties when urinating, it's time to pay close attention. You might notice that you're developing UTIs more often than usual, or that urinating becomes uncomfortable, marked by a burning sensation, cloudy or foul-smelling urine, or pain localized in the lower abdomen. Often, men also report feeling a constant urge to urinate, yet paradoxically find it hard to start the stream or fully empty the bladder. Now, occasional urinary difficulties can be benign, caused by dehydration or temporary irritation. But if these issues become recurrent or progressively worse, you may be seeing the early effects of prostatic inflammation or enlargement, which can be either benign prostatic hyperplasia, BPH, or something more serious, like prostate cancer narrowing the urethra or affecting nearby tissues. The message is simple. Don't ignore these symptoms, especially if they're repeating. It's essential to have them evaluated by your healthcare provider, who may suggest a digital rectal examination, PSA testing, or imaging studies to identify the cause. Sign 6, weak or interrupted urine flow. Another warning sign is a noticeable change in the force or consistency of urine flow. Many men write this off as a natural part of aging, but there's a difference between gradual aging and an abrupt or persistent disruption in function. You may find yourself straining to urinate, or perhaps your urine stream stops and starts multiple times. You might even feel that your bladder is never fully empty. Biologically, the prostate surrounds the urethra, so when there's swelling, inflammation, or growth, it presses on this channel, altering urinary flow. Studies confirm that urinary symptoms are among the earliest clinical manifestations of prostate changes, be they benign or malignant. So, if you're seeing regular alterations in your urination pattern, it's important not only to track them, but to act. Early clinical evaluation ensures that treatable conditions aren't allowed to evolve unchecked. Sign 5, increased urgency to urinate, especially at night. Let's talk about something many men silently suffer from. Nighttime urgency, the increased and often urgent need to urinate, particularly during sleep hours, also known as nocturia. If you're repeatedly waking up overnight to relieve your bladder, it's not just a sleep issue. It could be a symptom of underlying prostate disease. Sleep disruption is no small matter. Chronic poor sleep affects every aspect of life, from immune function to cardiovascular health, and even mood and cognitive ability. But more importantly, research shows that men with nocturia often have overlapping microbial inflammation, hormonal changes, or obstructive symptoms linked to an enlarged or affected prostate. If this issue has become frequent, especially more than once per night, it's worth documenting and discussing this with your physician. When paired with other urologic signs, it becomes a crucial piece of the diagnostic picture. Sign 4, blood in urine or semen. This next sign is one that should never be ignored: the presence of blood in your urine or semen, known medically as hematuria or hematospermia. This may appear as red, rust-colored, or brownish fluid. While there are benign causes such as infections or kidney stones, when you notice this symptom along with any other urinary or pelvic issues, a more serious cause, such as prostate-related pathology, must be considered. From a clinical standpoint, the prostate contains rich vascular networks, and any structural abnormality like inflammation, infection, or malignancy may lead to blood seeping into nearby semen-producing or urinary ducts. Even if it's only happened once, don't wait for it to happen again. Diagnostic testing, such as cystoscopy or advanced imaging like MRI, might be necessary to explore further. Early diagnosis, again, is where you gain the greatest leverage on your health. Sign 3, persistent pain in lower back, hips, or pelvis. Now, this is critical: ongoing discomfort in the lower back, pelvic region, or hips that just won't seem to go away. While this kind of pain might be attributed to aging, disc problems, or muscular strain, pain that persists, especially in combination with urinary symptoms, could indicate prostatic inflammation or even metastasis in later stages of cancer. Here's why. The prostate sits deep in the pelvis, and any abnormality has a tendency to refer pain to surrounding structures. Furthermore, advanced prostate cancer sometimes spreads or metastasizes to the bones, especially in the pelvis and spine. That means that recurring or worsening pain in these regions could be one of the earliest and most serious signals. Monitor your discomfort, note its timing, what aggravates or alleviates it, and, most importantly, talk to a medical provider about it. A physical exam paired with appropriate imaging can help identify the true cause. Sign 2, erectile dysfunction. While commonly discussed in hushed tones, erectile dysfunction, ED, can offer essential information about your prostate health. ED can arise from several causes, including stress, endocrine imbalances, or circulatory problems. But when you begin to experience erectile changes alongside urinary, pelvic, or systemic symptoms, it may be a sign that the prostate or nearby nerves and blood vessels are involved. ED isn't simply a sexual health issue. It's often a vascular barometer, a reflection of underlying insulin resistance, inflammation, or in this case, pressure on nerves running along the prostate gland. Advanced diagnostics today allow physicians to investigate erectile dysfunction not in isolation, but as part of a larger clinical picture that may relate back to prostate health. Don't be embarrassed. Bring it up openly with your doctor. Like any other change in the body, it deserves to be treated with respect and careful evaluation. Sign 1, persistent, unexplained pelvic pain or discomfort. And finally, the most important sign to watch for: ongoing pain in the pelvic region that you can't easily explain. This isn't the kind of soreness you get after a few hours of yard work or poor posture. This is deep internal discomfort, sometimes felt as a nagging, dull pressure, sometimes sharp and often extending into the lower back, groin, or thighs. Biologically, the prostate lies nestled within the pelvic floor. So when it becomes inflamed, enlarged, or structurally abnormal, the pain is transmitted to surrounding muscular and nerve areas. What's especially concerning is when this type of pain appears in the absence of trauma or strain and becomes either constant or recurring. If you're feeling something off in this critical area of the body, don't dismiss it. Document when it occurs, how severe it is, and whether it's influenced by movement, urination, or sexual activity, and take that information straight to a trusted healthcare provider. Before we conclude, let me leave you with this. The difference between treating prostate cancer early versus late is staggering. When caught early, it's fully treatable with excellent outcomes. When missed or ignored, it can lead to debilitating complications. Waiting rarely helps. So take this information and use it. Share it with the men in your life, your father, your brother, your friend, your partner. This knowledge, as research consistently shows, may be the very key to preventing delayed diagnosis and unnecessary suffering. If this presentation brought clarity or value to your life, consider staying connected with us. Subscribe for more data-driven, compassionate guidance on health and wellness. Your attention and action today could mean a markedly better prognosis tomorrow. Your health is not a guessing game. And with prostate cancer, hope lies in early detection, but only if you know what to look for. If any of the signs we discussed today sound familiar, or even if you've noticed changes that don't quite feel right, don't stay silent. Don't wait for a moment of crisis to act. Reach out to your healthcare provider, ask the questions, and get the answers. One checkup could be the decision that adds years, healthy years, to your life. If this video added value to you, please share it. Share it with the men you care about, the ones who might not speak up, the ones who think they're invincible. This conversation could save a life. And if you're committed to staying informed, empowered, and proactive with your health, make sure to subscribe. We're here to bring you professional insights rooted in science because prevention isn't just powerful, it's life-saving. Thank you for being here. Be well, stay vigilant, and remember, your greatest investment will always be your health.